So a brief 7-minute lightning talk. The issue we were trying to address in Essex was that Essex County Council was the top tier authority responsible for commissioning substance misuse services and outcomes. And having been a drug and alcohol commissioner for a number of years, I felt that we paid lip service to and were a little tokenistic around involving communities and service users. And we knew we needed to do something to change. And there was a recognition that we could do more and achieve more by working with people with lived experience. The outcomes that we were delivering were okay, but they were ultimately the outcomes that we as bureaucrats had chosen and that we as local authority commissioners were seeking to achieve. So we had to make a change. We knew we had to make a change. We had to grasp the opportunity to do something differently. So working with people in recovery and in treatment across the treatment system in Essex, we looked to create a community-owned function to take forward this agenda. So we have, in working with those individuals, created a charity called the Essex Recovery Foundation, snappily entitled. I hasten to add, it is known now as Revolutionising Recovery. And the charity comprises two boards. There is the typical board of trustees comprising members of the community and individuals with an interest in and an engagement with the agenda across Essex, and also those in recovery. And we have a second board called the Recovery Advisory Committee that is of equal importance and sits at the same level as the board of trustees. And this is chaired by and comprises people in treatment, people in recovery, carers, and family members. And we are, over a period of time, and this has not been a rapid piece of work to get off the ground with a small matter of a pandemic sitting in the middle of it all, we are slowly but surely transferring responsibility for the drug and alcohol agenda across to the charity. So we are transferring control of the drug and alcohol budget from within the public health grant. We're transferring control and responsibility for allocation of the new drug strategy monies that are being provided as a result of the comprehensive spending review. We have transferred the chairing responsibility for the partnership commissioning group across to the charity, and we have transferred the development of and the creation and consultation on the 5-year Essex drug and alcohol strategy to the charity. And they are also in the process at the moment, with support, developing the 5-year commissioning strategy for drug and alcohol services across Essex. We're negotiating a seat at the board of the Health and Wellbeing, the Essex Health and Wellbeing Board, for the charity in order that the charity can be at the top level of decision making around associated commissioning agendas as well as just the drug and alcohol agenda. And we are in the process of working with the charity to build structures and functions for them, to support them, to enable them to do this job most effectively. We are ultimately handing over the responsibility that sat with a small group of individuals sat within the public health team and other partners across to the community in Essex, and giving them that responsibility, giving them a responsibility to decide and define the outcomes that they are seeking to achieve, and giving them the responsibility for defining and developing where and how resources are allocated to achieve against those outcomes. So the Essex Recovery Foundation, in essence, will build a clear and shared understanding of the need as it exists across Essex. They will monitor the outcomes, the performance, and the delivery of the treatment system and support networks as they exist across Essex. And they will work with the providers that we currently have and the providers that they decide to procure and commission to adapt and evolve the provision, and to continue to develop and build a treatment system and support networks as they exist and as they need to exist, and to really meet the need across the county. And some of the really interesting bits of work that we've done and that have seen change, has been the development of a process whereby a needs assessment is going to shift from a standalone one-off function that happens every few years when we've got a bit of cash, to a process whereby the charity is now looking to engage a permanent partner to carry out a rolling program of assessing need, but also assessing impact, to give them a far clearer picture of where the decisions they are taking are impacting upon the outcomes that they are seeking to achieve as the community, and the people who really need these services to address their needs. So it's been one of the most exciting bits of work that I've ever been involved with. It's been something I've wanted to do for years. It's also been a process of me ceding control and realizing that actually things are going to get better with the community in control and in charge of its own provision, its own functions, and its own services and support networks. So it's been an interesting process. And at the moment, to date, touch wood, it has been a really, really valuable process of developing that trust with the community and ceding control. Thank you. That's probably got you back on time, I would imagine.